In this video, I'm going to be demonstrating and talking about sealants. This is our sealant tray setup. I have a curing light here. I'm gonna need a lot of cotton rolls, some 2x2 gauze, floss, and here is our pumice. This is a mixing well and micro brush, a bite block in case the patient's jaw doesn't want to be open anymore. Articulating paper, this is our sealant material and our etch. This is our hygiene handpiece, our disposable prophy angle, and we'll need a basic tray setup. The sealant is used to protect the deep pits and fissures of a tooth, which are these grooves here, protect it from getting a cavity. So when these grooves are really deep, usually on children or any pediatric patient, they will place a sealant to help protect that tooth from a cavity. So the first step would be the doctor is going to check the tooth for decay. You cannot place a sealant on a tooth that has decay or a prior procedure done to it because the material will not stick to the tooth. So once the doctor has checked and made sure that the tooth doesn't have any decay, you will go ahead and pumice the tooth. So this is our pumice here. What I'm going to do is I'm going to add some water. If I happen to add too much water, the best part is I can grab a cotton roll, stick it in here, and it will absorb all of that extra water that I don't need in here. What I'm going to do now is I'm going to put the pumice on the tooth. We're going to pretend we're working on tooth number 31. I'm going to have a fulcrum and I'm going to pumice, the occlusal surface only of this tooth. Next thing I'm going to do is I'm going to rinse the pumice off the tooth. So I'm going to have my HVE. It's going to be a little loud. I'm going to turn it on, spray air and water at the same time for a pressurized spray to get it all off. At this point, I would place 2 cotton rolls, one on the buccal side and one on the lingual side for isolation. This is going to keep the tooth dry and isolated while we place our etch. My next step is going to be to place our etch material on the tooth. I'm just going to squeeze it and place it on just the deep pits and fissures of the tooth where our sealant material is going to go. Remember, etch is an acid, it's phosphoric acid, so it's going to sit on the tooth for approximately 20 or 30 seconds. You don't want to leave it on too long. You want to make sure, once again, our cotton rolls are here to keep the tooth nice and isolated, and then after 20 seconds, we will rinse and dry. Now that I've rinsed the tooth, I'm going to spray air. The tooth at this point, once you have etched it, rinsed it, and you're drying it, should look white and chalky. That white and chalkiness has removed the smear layer of the tooth, which is going to make things adhere better to it. If you do not get that white and chalky look, almost like a frosted look on the tooth, you need to redo the etch step again. At this point, I would take out my cotton rolls that were here while I rinsed and dried and put a new set of cotton rolls that are completely dry, once again, to keep this tooth isolated from the sealant material we're going to place. So now I have my sealant material and I'm just going to put a little amount and kind of drag the tip of my syringe throughout those occlusal surfaces. I'm going to use my Explorer to help me get in those deep pits and fissures of the tooth. You do not want to overload it because it will affect how the patient bites. And then I will grab my curing light, making sure to look through this orange shield here to protect my eyes. And I'm going to light cure it for the manufacturer's instructions, so I'm going to go ahead and do that. So now that I have cured my sealant material, I am going to use an Explorer to make sure that there are not any voids in this, any air bubbles. When I say voids, I mean any space that I've missed where my Explorer is going to catch on it. Bubbles meaning there was a bubble in my material, so when I cured it, it cured with that bubble. Once again, will make this easier to break off and be uncomfortable for the patient. So once I have checked that there are no voids or bubbles, I will go ahead and grab my articulating paper to check the patient's bite. So I'm going to have them bite a couple times and grind their teeth. You can see here that the sealant material does not have any blue on it, which means that the occlusion is not raised, so it's not going to be uncomfortable for the patient. I would have them bite a couple times to see how it feels and get the blue marks off of my patient's teeth before I dismiss them. And then I'll have the operator come in just to check it before we dismiss this patient to make sure everything is good. And that is how you would perform a sealant.